have a reason to believe that our drugs, our vaccines, and the way that we normally prevent the spread of this virus may not be as effective in this particular strain.
Danger here at our doorstep. Medical experts believe the New York COVID strain has played a role in a 15% positivity rate in parts of New York City.
Channel 3 Eyewitness News reporter Matthew Campbell is joining us now live. And Matthew, what's the likelihood this variant is actually in Connecticut?
Well, Aaron and Mark, doctors we spoke with say it's high. In fact, our state has seen nearly 3,000 coronavirus cases since Friday, and the governor's team says 30 to 40% of them are coming from variants of some sort. But it's this New York variant that's very concerning because there's no data that shows how effective the vaccine is against it.
Brooklyn, parts of Queens, parts of Staten Island, the positivity rate's approaching 15%.
Former FDA Director Dr. Scott Gottlieb went on Face the Nation sounding the alarm about the New York variant, also known as 1526.
What we don't understand with 1526 is whether or not people are being reinfected with it and whether or not people who might have been vaccinated are now getting infected with it.
That's one of the biggest concerns medical experts have about this new variant. And Dr. Summer McGee from the University of New Haven says the fact that it's just miles away should make Connecticut concerned.
The fact that these cases are being detected, particularly in people who haven't traveled recently, really raises the concern that this variant is here. It's likely spreading much more than we know.
We took those concerns to Governor Lamont, asking about the potential it could be here. His team says Yale has been looking for all variants, including the New York one.
I think they are starting to look for that now, and we don't have any cases identified at this point.
But that's no reason for comfort, because doctors and the governor admit the current testing is not enough.
We're not really doing as much genetic sequences as we could.
We test an infinitesimally small number of COVID tests for variants.
Those small number of tests have already picked up confirmed cases of the UK, South African, and Brazilian variants in Connecticut. But the unknowns surrounding the New York variant have doctors concerned because with the state reopening, people could be lulled into a false sense of security.
Not a lot has changed. Even though people are fully vaccinated, all of those essential public health measures are just as important as ever.
Now, since testing for the variants isn't really where doctors say it should be, we're seeing the state rely on the vaccine. Doctors do say this is a race. Get people vaccinated, protect as many as we can to at least minimize the chance of the variant spreading and creating these mini outbreaks like we're seeing in New York. Live here in the newsroom, Matthew Campbell, Channel 3 News.